My name is Juliana Chan. I'm the Chief Executive Officer of Wild Tide Media Group and a science communicator based in Singapore. We are here today to discuss an unfolding situation, that of a novel coronavirus, the Wuhan virus. It is named because it first appeared in December in a seafood market in Wuhan, the largest city in Hebei province in central China, with a population of 11 million. So it has been compared to SARS, which caused the deaths of nearly 650 people across mainland China. And to date, we have already had more than 570 cases and 17 reported deaths. Just today, a few hours ago, Singapore, where I'm from, announced its first confirmed case. So we have three experts with us today to help us put in context the unfolding situation. On my left, we have Dr. Jeremy Farrar, Director of the Wellcome Trust in the UK. Next, we have Dr. Richard Hatchett, Chief Executive Officer of CEPI, which stands for Coalition for Epidemic Preparedness and Innovations. And finally, we have Mr. Stefan Bancel, Chief Executive Officer of Moderna, a US-based biotech company. So I'll start with trying to understand what we are dealing with right now. And for that, Jeremy and Richard, could you kindly tell us what we know now of the virus and what do we expect to happen next?
Yeah, thanks very much, and thanks to everybody for joining. Just back a little bit, so you can appreciate what I'm going to say. I'm an infectious disease person by background, worked very, very closely with China during the SARS outbreak, and spent 20 years living in Vietnam, but working very closely with many countries in the region. So that's my background of where I come from. This infection, which has come about from the beginning of December, started, as you say, in an animal market in Wuhan, and probably was a virus that was infecting animals, most likely, I think, bats in that market, and it crossed the species barrier and it came into infecting humans who were working or visiting that market. Subsequently, through the month of December and then the early days of January, that infection spread from animal to human, but then most importantly from human to human. And now we are sort of the end of January, so we are about 6 weeks into this outbreak. This virus can now clearly spread between humans. It's spread by the respiratory tract. That means that somebody with symptoms would have a cough, a sore throat, and would pass it to somebody else by coughing or sneezing in the same way that influenza is spread around people. It is not SARS. The virus is in a similar family to SARS, but this looks different to SARS. And the difference is probably it's easier to pass between human beings. SARS was quite difficult to pass between humans, and people were most infectious when they had symptoms, and therefore it was relatively easy to bring the epidemic under control. When an infection spreads between humans easily, it's actually very difficult to bring the epidemic under control. And so there's a very big difference between SARS and what we believe we know about this virus so far. The infection is now spreading, of course, across China, and many cities in China have reported cases. Indeed, Singapore reported a case, and other countries have. And I think we can expect that there will be many more cases in China, and that there will be many more cases in other parts of the world. I would stress also, in comparison with SARS, that the infectious rate will probably mean in the long term that it will cause fewer people will die. 10% of people died in SARS. I suspect the mortality rate with this infection will be lower than that as it spreads to a much wider population. So what we have is a broader infection with probably a less marked number of people, percentage of people dying. But that, in some ways, from a public health perspective, is harder to deal with. We can't predict the future, and we're living in a period of great uncertainty at the moment because we don't have all the information we need. China recognized this, it shared the information very quickly. That was different to SARS, and therefore it alerted the world to this outbreak happening. That would not have happened maybe 10 or 20 years ago, and we should congratulate China in the way they've been open and sharing of the information. The future, the world has got to think about how we can prepare now by developing vaccines. Richard will talk about that, drugs that may counter this infection, but also what we can do at a public health and societal level to try and prevent the epidemic spreading further than it might otherwise do.
Thank you, Jeremy. Richard, do you have any points to add?
I think Jeremy has given a terrific summary of what we know. I think I would like to underscore what we don't currently know and what makes it very difficult, as Jeremy is saying, to prognosticate the future. We do not have a detailed understanding of infectiousness. We are inferring a lot from the numbers of cases, and I think Jeremy's inferences are strong, but we have to recognize that we don't know anything with certainty yet. We don't understand the transmission dynamics of the disease. We don't understand yet the severity of the disease. It is very difficult during a period when the number of cases is increasing exponentially to make inferences about the severity, to understand what the mortality rate actually is. We don't know the number of cases. We don't know the extent of spread. This is all critical information that will inform what is required to bring the outbreak under control, and I am sure that Chinese authorities are digging as quickly and deeply as they can to understand all of these factors. And so over the next several weeks and even months, we will have a greater understanding of all of these issues, and it will help us tailor and target our response appropriately. By point of comparison, in 2009, I was working in the White House helping orchestrate the pandemic response to H1N1. We knew by the end of April that the virus that was spreading, H1N1, was going to cause a global pandemic. We did not have an accurate estimate of severity until August. And that was with a virus that was reasonably well understood from the beginning and very intensively studied. So many of these answers may not become available in the time fashion that we would all like. And we're going to have to make decisions under ambiguity and uncertainty, and we're going to have to make decisions that have potentially very significant cost. We are seeing that currently in China with some of the decisions about travel restrictions. And we as an organization, CEPI, we were set up to fund vaccine development. Vaccine development is a very expensive undertaking, but if we don't take steps now, we won't have the vaccines in a timely fashion.
Thank you, Richard. So, Jeremy, this is for you. So I'm Singaporean Chinese, and you may be aware that on Saturday is the first day of Chinese New Year, is 华人新年初一. So hundreds of millions of Chinese people around the world will be traveling to either go home or visit a loved ones. We know that they have already locked down the city of Wuhan and others as well. Are countries taking enough precautionary measures? What else must we be doing? Thank you.
Yeah, no, I do know it's China. I was born in Singapore, so I am ingrained in that. In many ways, this outbreak, as so often happens, couldn't be happening at a worse time. I mean, Chinese New Year, I believe I'm right in saying about 450 million people will be traveling in China alone, and then many people in the region, and then globally. During the pandemic of 2009, which Richard refers to, when, in fact, we started working together in some ways, we did some work in Vietnam, where I was living at the time. Travel restrictions are a very important sense that the authorities are doing something. Mm-hmm. It's a very important statement to communities that this is serious. The actual impact of travel restrictions, at least in my opinion, are not going to be the answer. Firstly, you can't stop everybody traveling. If you stop people traveling, they often find other ways to travel that may be not so obvious. And in the end, if I were infectious now with no symptoms, I could pass it on even though you may not know I was sick. So travel restrictions can buy you a bit of time, and that's very important to do. It might buy you a day, it might buy you a week, it might buy you 2 or 3 weeks. But in the end, you have to use that time to put in place the critical public health interventions that you need, because travel restrictions on their own will not stop this epidemic moving.
Thank you. So on that note, I think, Richard, it's a good time to talk about CEPI, because it was launched 3 years ago right here in Davos, in the shadow of the Ebola outbreak in West Africa. So what is CEPI's response to Wuhan virus, and what is on the research agenda?
Sure. No, CEPI, the Coalition for Epidemic Preparedness Innovations, was established by global public health authorities. Jeremy played an important role with others in setting CEPI up, and was funded by a number of philanthropic organizations in sovereign countries for exactly this kind of event. It was set up to develop vaccines against diseases like Ebola that we know about, and to be prepared for the next unknown disease, the next epidemic, so that we could respond rapidly. So CEPI is focused exclusively on vaccines, and we have been working very aggressively over the last couple of weeks to assess the situation first, to try to make determinations about what steps are appropriate. And as the epidemiologic situation has unfolded, our sense of what we need to do has become more clear, and our sense that we need to move faster and move farther, perhaps, has also become more clear. Today we can announce, in fact, this is the first time that we've announced this, 3 partnerships to develop vaccines against the novel